Hi, this is Chris. Welcome back to Chapter 11. We're going to get into bundle branch blocks. So you see the conduction system there, and as you can imagine, if there's a bundle branch block, you either have a interruption in electrical activity on the right bundle branch or the left bundle branch. Let's start with the left bundle branch block and discuss some of the characteristics that you're going to see on the 12 lead. So if there is a left bundle branch block, you're going to have a QRS complex in lead V1 that is wide and negative or down. In other words, that vector is going to be upside down, which is what we normally see in V1, correct? However, in this case, it's going to be wide. So what is happening is the flow of electrical activity makes it into that right bundle branch, gets blocked on the left side. So the heart depolarizes on the right side and then sends the message kind of around the area that is being blocked, which happens a little bit more slowly, and that's why the QRS complex is wide. Remember, we're using lead V1, and a trick that you can use is to imagine you're driving a car in the direction of V1. And when you get up to V1, if you have a wide complex, imagine that if it is downward, you're going to pull down on your turn signal to turn left. That indicates you have a left bundle branch block. We'll talk about the variation when we get to the right bundle branch block. As you can imagine, it's going to be upward, and you would click up on your turn signal to turn right. Keep in mind that the left bundle branch block in V1 tends to have that small R wave in there. So you'll see in many textbooks, it will indicate that there is an RS pattern. All right, there's your example of left bundle branch block. It's downward in V1. And now we get into the right bundle branch block. So with a right bundle branch block, you can see there's our X, and the characteristic pattern that you might see in lead V1 is known as an RSR pattern. So you have two R waves. Sometimes that second R is referred to as R1. And essentially what is happening is you have depolarization of the septal area of the ventricle, of that left ventricle, and that causes that little blip R wave to come up. But then you have a blockage in the right bundle branch, and therefore you have all of this electrical activity flowing to the left side of the heart, but nothing going to the right. There, and because we're talking about lead V1, that's why you have an S wave, which is a negative vector. All right, and then you get into the third shaded area of the conduction system there. So eventually the right side does get depolarized, and in this case, that electrical activity is flowing in the direction of lead V1. So remember, with lead V1, you can't think of it in the horizontal plane. You have to imagine three-dimensionally that lead V1 is sitting on the outside of the person's chest and picking up electrical activity that is heading in the direction from inside the chest in a transverse plane, if you will. All right, so there's our trick with the car driving in the direction of V1. And if we have a right bundle branch block, you're going to click that turn signal up, indicating that you're going to turn right, so to speak. Here's your example of a right bundle branch block. You can see lead V1 has that characteristic RSR pattern. There's an image of it blown up. So what causes bundle branch blocks? It could be a lot of things. All right, there's some reasons why you might have a left bundle branch block, and there are a list of reasons why you might have a right bundle branch block. Depending on the protocol where you work, if you have a patient who is experiencing acute coronary syndrome in the form of chest pain, fatigue, weakness, shortness of breath that came on somewhat suddenly, and you notice that they have a left bundle branch block, according to ACLS protocol, you are to call a cardiac alert or a STEMI alert because, as indicated on this list, it could be a heart attack, with a right bundle branch block, it is possible they could be having a heart attack, but it's much less likely. So that is why you don't call a cardiac or a STEMI alert for a new onset right bundle branch block. All right, I hope that's helpful. I will see you in the next video. Take care.